Good morning friends, how are you? I hope you all are safe during this lockdown period. Stay home, stay safe. Yesterday we learnt about testy baby, abortion and medical termination of pregnancy, that is MTP. Today I am here with you with few topics like STDs, that is sexually transmitted disease, its symptoms, effects, prevention, infertility and assisted reproductive technology. Okay friends, first of all we will discuss about sexually transmitted diseases. Sexually transmitted diseases are diseases which are spread by sexual intercourse with infected person. These diseases are also called venereal diseases or reproductive tract infections. The common sexually transmitted diseases are gonorrhea, syphilis, chlamydiasis, trichomoniasis, genital herpes, genital wart, hepatitis B and most dreadful AIDS, that is acquired immunodeficiency syndrome. Except a few like AIDS, genital herpes and hepatitis B, all the sexually transmitted diseases are completely curable, but if it is detected in early stage and treated properly. Now let us see what are the symptoms and effect of sexually transmitted disease, that is STDs. Alarming symptoms are itching, fluid discharge from genital region, slightly pain and swelling in genital region. The effects of sexually transmitted diseases may lead to pelvic inflammatory diseases, abortion, stillbirths, infertility, ectopic pregnancies and also cancer of reproductive tract. Now the question arises how it can be prevented. The sexually transmitted diseases can be prevented by maintaining sexual hygiene, by avoiding multiple sexual partners and also by avoiding sex with unknown partners. It can also be prevented by prompt treatment of discovered cases. Now our next topic is infertility. Infertility means unable to produce young ones. In India, large number of couples are infertile. So those couple who are unable to produce children in spite of unprotected sexual cohabitation are called infertile. The reasons of infertility may be physical, congenital, due to drugs, immunological or psychological. Infertility may arise to any of the partner, either male or female. Last topic of this lesson is assisted reproductive technology. These are the techniques by which parenting pleasure can be given to a couple. The couple assisted to have children through certain special techniques are commonly called as assisted reproductive technology. There are different assisted reproductive technologies. We will discuss here one by one. First is IVF. IVF means in vitro fertilization. In this case, fertilization is done outside the female body by providing similar conditions as that in the body. It is then followed by embryo transfer to form test tube baby. This is the pictorial representation of IVF. You may observe here that fertilization of ovum is done by a sperm outside the female body. Second assisted reproductive technology is GIFT, that is gamete intrafallopian transfer. As the name indicates, GIFT is the transfer of gamete. So, in this case, there is transfer of ovum collected from donor into the fallopian tube of another female who cannot produce ovum but can produce suitable environment for the implantation of blastocyst and further development. In the given figure, it is shown that there is introduction of ovum by gamete introducer. Next method of assisted reproductive technology is ICSI. What is ICSI? It is the intracytoplasmic sperm injection. In this case, formation of an embryo in the laboratory in which sperm is directly injected into the ovum. In the given figure, you can see that here sperm is injected within the ovum with the help of needle. The next method is artificial insemination, that is AI. It is the introduction of semen either from the husband or from a healthy donor into the vagina or into the uterus. Whenever it is introduced into the uterus, then it is called as intrauterine insemination. The given figure indicates about the type of artificial insemination. Either artificial insemination is by husband or artificial insemination is by any donor. Next is ZIFT, that is zygote intrafallopian transfer. It is the introduction of transfer of zygote or early embryo into the fallopian tube of female. The given figure indicate about zygote intrafallopian transfer. Now the last one is IUT, that is intrauterine transfer. It is the transfer of embryo with more than 8 blastomeres into the uterus for further growth and development. Here you may see that there is transfer of embryo in the given figure. Either the transfer of embryo is multiple or the transfer of embryo is single. Now it is clear to all of you that the various concepts of today's session. Thank you children and have a lovely day. For any kind of doubts, please write your questions in the comment section.